Hi, I'm Dr. Steve Walton. I've been a chiropractor for 35 years. I've been in private practice here in Hawaii for the last 30 years. I'm also the Director of Clinical Development for Sense Technologies Incorporated, the inventors and manufacturers of the most advanced chiropractic instrumentation available today. We recently stumbled across 4 studies that were done overseas in the last few years, demonstrating the incredible effectiveness of the PulStar instrument. I'm going to summarize all 4 of these studies very quickly. Here's one. It's the multiple impulse therapy done in Poland. Multiple impulse therapy and the assessment of paraspinal muscle tone in patients with low back pain. They evaluated 117 patients. Okay. And they compared the PulStar analysis with surface EMG and visual analog scale, and they found that the PulStar analysis, as it improved, muscle tension decreased, and the pain levels decreased by 40%. So that's a pretty cool result. Here's another one, again, done in Poland. Now this one's a randomized controlled trial. That's the gold standard in clinical studies. It's so difficult, expensive, and time-consuming, only 15% of all medical interventions have been validated by this method. This one compared the PulStar instrument to the Saunders lumbar traction. And what they found was both methods helped patients decrease the low back pain. But the PulStar did it faster, 5 sessions instead of 15, and the results lasted longer after the PulStar, including the pain relief results. So that's a pretty cool one, too. Here's another randomized controlled trial. This one was done in China, and what they do is they compare the PulStar instrument with their conventional treatment, which was acupressure. And what they found again was both methods helped the patient, but the PulStar was more effective, quicker, and for example, 90% of the patients recovered completely with the PulStar, whereas only 70% did with the acupressure. And there's some other interesting findings here. But again, another study demonstrating the superior effectiveness of PulStar and its multiple impulse therapy. And then finally, here's one that was done in China. This is a clinical study. PulStar treatment in 45 cases of calcific tendonitis or frozen shoulder syndrome, diagnosed by loss of range of motion, incredible pain, and X-rays showing calcification of the supraspinatus. Over a period of 2 years, every case that came in with this condition, calcific tendonitis, they used the PulStar instrument on. They used the soft tissue techniques that we have developed, utilizing special instrument heads. Here's one that you can multifunction. You can do Graston type techniques with. And what they found was, and this is the incredible part, at the end of a course of treatment, which was 5 to 10 sessions, 99.4% recovered completely. That is, they had complete range of motion, no pain, and furthermore, with X-ray, there was no more calcification of the supraspinatus tendon. So these 4 trials are really awesome. They're amazing clinical trials and clinical studies that we've been really hoping to be able to do here in the United States, but we just haven't been able to pull it off. So these 4 incredible studies are something we've just recently discovered, each of which validates the effectiveness of the PulStar multiple impulse approach. We invite you to review the actual published clinical trials or to download or read a document summarizing them all. Thank you.